Good Saturday morning, everyone. Today on Perspectives, after 2 frightening years, can it be true that the number of people who are suffering from COVID-19 and its variants are actually dropping? Well, according to the now retired director of the Mobile County Health Department, Dr. Bert Eichel, this section of the Gulf Coast could be the, quote, test tube for the rest of the nation, due in part to our past Mardi Gras celebrations. Scientists like Dr. Randy Murphy, an epidemiologist with the Mobile County Health Department, says that the weeks following our Mardi Gras celebrations will be a determining factor to see if COVID and its variant levels will increase in the number of hospital admissions and infections. Health officials urge families to take precautions. Dr. Murphy says that it won't be until a Friday coming up until we see the full effect. The good news, Dr. Murphy says, though, that she doesn't expect to see a large bump in the cases. Now, unfortunately, though, the mask mandates and the vaccines, especially for children, became a political hot potato, with many politicians telling Americans that the masks were not necessary. A case in point, back in March, Florida Governor Ron DeSantis criticized some students at one of his news conferences for wearing masks.
You do not have to wear those masks. I mean, please take them off. Honestly, it's not doing anything, and we got to stop with this COVID theater. So if you want to wear it, fine, but this is ridiculous.
Well, the Centers for Disease Control and Prevention recommending, though, that children ages 5 years and older to get a COVID-19 vaccine. The CDC says there are approximately some 28 million children between the ages of 5 and 11 in the United States. And there have been 2 million COVID cases in this age group alone. They say the complications, though, can lead to death. Our guest this morning, epidemiologist Dr. Randy Murphy, the director of the Bureau of Disease Surveillance and Environmental Services with the Mobile County Health Department. Dr. Murphy has become the very public face of the local fight against COVID-19 and, of course, the variants that followed. Dr. Murphy has extensive experience in public health surveillance and outbreak investigation as a CDC Epidemic Intelligence Services and Career Epidemiology Field Officer. So stay with us this morning as we discuss Mardi Gras' possible effects on COVID cases, as well as mask mandate removals, the state of vaccinations, and more, as Perspectives continues after this quick commercial break. Our guest this morning, Dr. Randy Murphy from the Mobile County Health Department and epidemiologist there. And Dr. Murphy, you've been on the front line for the last 2 years now. We thank you for joining us in the studio this morning. Our first time in a couple of years having you here with us. And of course, we both are fully vaccinated and you're boosted. I'm waiting on mine now. I'm eligible this month.
Good.
And so taking our precautions. Let's talk about where we are now, because it is a brand new year. And of course, just finished up a Mardi Gras here in the local area. And one of the statements made, I'd like for you to respond to that by outgoing Mobile Director of the Health Department, where Dr. Eichel made the statement that we will be the test tube for the rest of the nation right now due to the Mardi Gras experience here. How do you respond to that?
Yeah, well, first of all, recognize that Dr. Eichel gave 31 years of service to the health department. We are so thankful to that for him. So yeah, you know, we were concerned anytime you have large social gatherings, whether they're indoors or outdoors, and you have a mix of people who are vaccinated and unvaccinated, maybe even a mix of people who have underlying health conditions and who don't, we always worry. So, but we knew people were going to celebrate Mardi Gras. People are just ready to get back to something that looks like normal life. So we encouraged people, you know, to take precautions as they could, maybe shorten the length of time they were indoors, maybe stay at home if you do have an underlying condition, or, you know, surround yourself by family that are fully vaccinated to give you a little bit of a buffer of protection. And so far, we've not seen a spike in the number of cases from the first week or two of Mardi Gras, but it'll be until this Friday until we really see the full effect. But I don't expect that we're going to see a large bump in cases.
So it takes at least, what, a week to 2 weeks
yeah,
to get an idea of how the surge, if it's a surge.
That's right. So with Delta and previous variants, it was 2 to 14 days. With Omicron, because it's much more highly infectious, it's around 10 days. So that'll be this Friday, March 11th. So that's kind of the day that I'm keeping my eye on. If things stay low, it looks like they have. Today's report still looks really good. Then we'll be thankful that maybe everybody that was going to get Omicron got it before they came to Mardi Gras.
You know, I was wondering about, going to ask you about the numbers. What did you think about it? 8 cases reported yesterday, only 6 hospitalizations. I guess that's pretty good.
It is, and there have been less than 50 people total in the hospital with COVID the last couple of days, so that's down where we like to see it. We'd like to see it, get even lower than that, but the number of cases that we're seeing and the hospitalizations being low, the number or the percent of the tests that are positive is back very low again, back close to the numbers that we enjoyed in November. So that's allowing us to take some liberties and get some things back to normal.
Now, Dr. Eichel also said that hopefully COVID is over. Can we move into that direction now?
Yeah, well, it probably is over for people who are healthy and that are fully vaccinated. If they get COVID, the Omicron variant, at least they're going to have a very mild illness, something that, probably is less mild than flu or one of the common colds. So that's the really good news. CDC is posturing towards something that looks like normal. They no longer expect us to investigate every single case of COVID. And instead, what they're doing is looking at protecting our healthcare systems. Okay. So they're looking more closely at the number of people hospitalized with COVID and the percent of beds that are filled as kind of an indicator. So again, just trying to preserve our healthcare system and to protect those who are at risk of most severe illness.
Of course, there have been periods throughout the last 2 years where we were very concerned about it being completely overwhelmed and things breaking down. How has it been the last couple of weeks with the lower numbers? Are we getting back to normal again within the hospitals?
We are, and the good thing during the Omicron surge, because it is a less severe variant, the hospitalizations that we did see were a shorter course. People weren't as sick, not as many people needed intensive care or mechanical ventilation. So that was a benefit to the hospital. So yes, we still had pretty high numbers of COVID cases, but overall cases were less severe, which greatly helped the hospitals out. Unfortunately, we have still lost people to the Omicron variant.
Yes.
We've lost people who were fully vaccinated but had underlying health conditions and unfortunately caught Omicron. And we've lost mostly people who died were unvaccinated, but it's still unfortunate to have any deaths. WHO announced, I think just this week, that globally there have been 6 million deaths to Omicron. So just something we hope we will never see again in our lifetime.
And of course, we're approaching near 1 million in the United States right now.
I know.
When you look at these numbers, overall, the county has done pretty good. I guess no loss of life is good, but as far as the numbers comparing to what is happening in other parts of the country, overall, we've done decent. Right.
Well, a big change during the Omicron wave, of course, it was less severe. And then also the other big difference is 84 to 85% of people in nursing homes and long-term care facilities were vaccinated, and so that protected them during Delta and it protected them during Omicron. A lot of the deaths that we saw in the first year were people who, were in congregate settings where COVID would spread very fast. They had underlying health conditions, and we saw higher death rates in those communities. And during Omicron, we saw a much lower overall death rate and very few hospitalizations and deaths coming out of those congregate settings.
So you're saying that the vaccines have worked and science wins?
Yes. The vaccines largely did their job, particularly in, like I said, nursing homes and long-term care facilities. And also, if you look at the data, we saw many, many more children hospitalized with Omicron because they're too young to get vaccinated, because there's not, universal masking. And whatever your belief is about masking mandates, I mean, the data and science and common sense are showing that it works to slow transmission. But we're in a better place now, and so I think that you're going to see, larger universities are dropping indoor mask mandates. Businesses are beginning to drop indoor mask mandates that had them before, and so we're going to start seeing a shift away from indoor mandatory masking for everyone, including vaccinated and unvaccinated.
We're getting ready to get to a break here shortly, and we'll get back into that area because Florida's governor just made some statements about vaccinating children that you were just speaking of under a certain age. And so masks aren't recommended for the children since they are not vaccinated, usually under that age of 5?
Well, we say children 2 or less should not wear a mask, but over the age of 2, masking is appropriate when it's properly worn, and kids have shown resilience in being able to wear a mask. I think some of the controversy has been, requiring a mask. That's where sometimes we get a lot of pushback. But yes, the Centers for Disease Control until recently had recommended universal mask wear in all indoor settings, including schools and especially schools, because we know that the vaccination rates for kids 5 to 11 are lower because that vaccine just has not been authorized and fewer parents are taking their kids to get vaccine.
A lot to think about still for both the parents, administrators,
Yes.
superintendents, a lot of decisions to
And
make
school
there.
nurses, they are put in a tough
Yes.
position and they have a hard job to do, so we are
And I'm
very
glad you
thankful for
mentioned that
them.
because we haven't heard a pat on the back for them,
Right.
during all of this
They deserve
controversy.
kudos, yes.
Yeah. Well, Dr. Murphy, thanks for joining us on this first block. We're going to take a quick break. We'll come back, more conversations with Dr. Wendy Murphy. Welcome back to Perspectives. Our very special guest this morning, Dr. Wendy Murphy from the Mobile County Health Department. Dr. Murphy, and we're talking about where we are right now with COVID-19. We talked about a couple of things earlier as relates to the numbers and how things are going now, comparative, and of course, coming out of the Mardi Gras season. No surge as of yet, but we still have a few days under our belts to look at how we respond. But the overall community transmission level, you're rating now as moderate as of yesterday's report. Only 38 new cases of say per 1,000 persons over the last 7 days, and so we're looking good there. And then the percentage of positive RT-PCR tests at 6%. Are we in the window now that we've been working towards?
Yeah, the holy grail really has been less than 5%.
Right.
And so that's what we've been looking for. It's interesting though, because we're moving away from using that metric with as much reliability and emphasis and trust as we had before because of the movement to at-home testing. And in most jurisdictions like ours, if someone tests themselves at home, it does not get reported to public health.
Right.
And so, and people all over are if they do get COVID, they're less symptomatic, so they're less likely to go and get a test. And so what CDC is doing is moving away from that metric as being kind of the gold, one of the gold standards, but I'm really glad to see it super low. So in some calculations, I've seen it less than 5%.
Oh,
so
good,
it's good to see it going in that direction.
Now, notice though, on 3 of the zip-coded areas, we have they're in the range of the 501 to 750 in 3 zip-coded areas in Mobile County. What's going on in those communities?
So we sometimes see hot spots, with people who, families that all get tested, right, and they all have the same, physical address, or maybe they all live on the same block. Sometimes you'll see churches maybe that have, a case or 2, and then people from that community will get tested. So we still are seeing clusters, what we call a cluster or a small outbreak of cases, and that's really where we turn our attention. In particular, looking at clusters in congregate settings where people are at higher risk of disease. So now that CDC is not recommending investigating every individual case, the health department will turn our attention and focus more. We've always done it, but we'll have more resources now to investigate those clusters and those geographic geographic areas that you're talking about.
Well, that's more positive reports coming from you. And talking about the CDC, we had mentioned earlier about some of the things happening in Florida, and of course we're right at the doorstep of Florida. But some doctors have now spoken up against some of the actions taken by the Florida Surgeon General in, I guess you could say, conjunction with the governor. And the doctors are now saying that they shouldn't be opposing the COVID-19 for some kids, and they're saying healthy kids don't need to worry about it.
Right.
But it sounds like we're saying, though, that for those who are vaccinated, you're going to have an easier time dealing with possible transmission.
That's right. The announcement, the news coming out of Florida is surprising to me. You know, we continue to follow the CDC advisory Committee on Immunization Practices. We follow their guidelines and their recommendations for all childhood immunizations. And right now, the data look good for children. It's protective, it's safe, and so we will continue following the advice of CDC and the ACIP. Having said that, data are being gathered all the time, and if something changes, I know that FDA and CDC will do the right thing and, you know, make changes to their accommodations or to their recommendations. That's frustrating to lots of people when they say something and then a month or two later come out and say something different. But it's just been the nature of this experiment that we've been living in, that we are gathering information and data as we go along. And so right now the health department is still recommending vaccination for children who are at least 5 years old.
All right, those who are eligible. It's been frustrating for me hearing the people not giving science the opportunity to work and to see that I think you all said, we're in real time here with what we've been doing the last 2 years. And so it is a learning curve.
Oh, absolutely. I mean, this is something that is unprecedented in our lifetime, a novel coronavirus, right, which means it's brand new. No one's ever seen it. We've had novel viruses emerge before, but none that took hold and sort of, you know, controlled what's happening around the world like COVID-19 has. And so we have just been you know, learning and adapting, and part of that is, you know, right now, we were talking about it being 2 years since we first started talking about COVID. Then we didn't have rapid tests, we didn't have antivirals, we didn't have monoclonal antibodies, we didn't know the science around masking and distancing. We you know, just a vaccine was just kind of a holy grail, just a concept back then. And now here we are, and we have all of these things. And if we use them and continue to believe in the data and the science and use common sense when applying them, then I hope that we will stay at a very low level of transmission that we're enjoying now.
And didn't we learn something from seeing the way the flu season happened during the last 2 years?
Right. Last year, maybe people have forgotten, but because we were masking and schools were closed and people were telecommuting a lot, we didn't have a flu season last year. And we had a flu season this year, but it has plummeted as in a similar way that the COVID cases have plummeted in the last couple of weeks. So I'm not real sure what's going on around that. Sometimes people think maybe that COVID sort of outcompeted flu, or maybe we're going to see just an atypical season again this year. But yeah, the presence of SARS-CoV-2 has just interrupted some of the normal cycles of respiratory virus that we've seen in adults, but particularly in children.
Talk very quickly, if you can, about some of the things that we are able to do now again when we talk about going inside for certain things, eating places, church, other places like that.
Yeah.
What should be our procedure at this time?
So I have always encouraged people to use the layers of prevention as peeling back the onion or layering on. And right now we're in the, you know, slowly peel back the prevention measures. So if you are fully vaccinated and you've been boosted, then carry on your outdoor activities, you know, without a mask. Of course, if you're in a packed gathering, you might consider putting the mask back on even if you're fully vaccinated. If if you have underlying health conditions, you may still want to wear a mask even when you're indoors. So you just need to sort of, like I say, use that sort of science, knowledge, and common sense to apply those prevention measures when you put yourself at increased risk. But we are going to start seeing, we've already seen mask mandates dropped at schools. We're going to begin, seeing people going back to church, having funerals, having, indoor weddings, that sort of thing. So again, it's really going to be up to the individual to decide, like, what is my risk level walking into this room? Right. Am I vaccinated? Do I know if everyone here is vaccinated? Am I healthy? Is everyone in the room healthy, or are there elders here? So really just kind of thinking about that when you are making your decisions about what prevention measures to apply or to let loose of, right? And by prevention measures, really vaccination, and then distancing, masking, sanitizing your hands. For everyone, regardless of vaccine status, stay at home if you're sick. Don't come out and infect the rest of us.
Some very good points there. And of course, we're all wondering what lies ahead for us in the months ahead as far as we head into the summer and then the winter again. And of course, we'll have you back and we'll talk more and see where we are. But thank you so much for being here today and sharing this just invaluable information.
It's my pleasure.
And once again, for more information on the COVID pandemic and where you can get vaccinated or you can receive a booster shot, you can check out their website at mchd.org. The phone number, by the way, is 251-690-8889. You can also gather updated information on the Health Department's Facebook page. Well, next up on Perspectives, if you haven't checked them out lately, there are a lot of new opportunities in the Alabama Community College system. The goal is to help you prepare for a great future. It's all about training you for the workforce. Well, the system has made a major commitment and is also offering new training opportunities through the Innovation Center. We'll find out about the different offerings, how do you qualify, how to register, and what to expect after completing the program. We talked to representatives from the Alabama Community College system. Well, please join us here next Saturday morning for Perspectives as we discuss those important issues. I'm Eric Reynolds. Have a great week ahead.
Thanks for watching Fox 10 News. Watch us live wherever you are on our mobile, our streaming news app, and you can also watch us on Roku, Apple TV, and Fire TV.